What happens when therapy is tailored just for kids? We're joined by Elizabeth Carter and Alex Kastl from HSHS St. Anthony's Memorial Hospital to talk about pediatric specialized therapies and how speech and physical therapy can transform a child's development. That's what's next on Being Well.
This is you, and you are why we do what we do. Because the way you feel matters. Sarah Bush Lincoln, trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl is always at the forefront to help you thrive.
And welcome back to another season of WEIU TV's Being Well. I'm your host, Lacey Spence, and we are kicking off today. We are going to be talking about different therapies specialized for kids. We've got two fabulous guests joining us today, and they're new guests to Being Well. We welcome you all to the studio, the set, the season. Great to meet you all. Can you please introduce yourselves?
Yeah, I am Elizabeth Carter. I am a speech therapist with HSHS St. Anthony Hospital in Effingham. I've been a speech therapist for 8 years now. I actually went here to Eastern Illinois University for my undergrad and graduate school, so it's exciting to be back. And I'm going to talk a little bit today about AAC and all that it entails.
Awesome.
My name's Alex Kastl. I'm a physical therapist for HSHS St. Anthony's. I've been practicing physical therapy for about 9 years almost now, so I'm excited to be here. Thank you for having us. Today I'm going to be talking a little bit about a new piece of equipment that we have recently gotten in our clinic that is going to be helpful for kids as we do some therapy with them, and it's called the Universal Exercise Unit.
Wonderful. Well, welcome back to campus.
Thank you.
We tape on the campus of Eastern Illinois University, so it's always exciting when we have alumni back in the house. So as we kind of start this conversation, and we are maybe thinking about our kids, our friends' kids, or nieces or nephews, what would make a child a good candidate for, again, we've got speech, and then we're also going to be talking about the physicality side of things.
Yeah, so I'm talking about AAC, and that's a lot of our kids who are nonverbal. So they're not speaking at all, and we need to help them find a way to communicate. So if you're having trouble getting your words across or getting your point across as a child, that would be a good candidate for someone for speech therapy.
Okay.
Yeah, and from the physical therapy standpoint, I work with kids with all sorts of mobility deficits, whether it be, a nervous, like a neuromotor issue where they just can't figure out how to move their arms or their legs correctly. It could be a developmental issue where they're just not meeting their developmental milestones as they're growing and learning how to move their bodies. So any kid with that sort of issue would be a great candidate for physical therapy.
Sure, and then just to back up a little bit, thinking about how every child is going to be different. And so you mentioned those developmental milestones. At what point should I be concerned that they're not hitting those milestones? Because you kind of hear the phrase maybe like a late bloomer, but everything worth having is worth waiting for, right? So how do we know when we need to seek out extra help?
Yeah, it's a very gray area for a lot of kids because, kids are kind of going to do things on their own time. But when they're falling pretty far behind, 3 to 6 months behind when they should be hitting some of those developmental milestones, that's probably the time we really need to seek intervention and get these kids in to get them caught up, because when they fall behind like that, they lose out on some of the growing the aspects that they need to continue to develop and move appropriately.
Yeah.
And prevent any sort of issues further down the road.
Yeah, and so I would say be in contact with your pediatrician. They're aware of all these milestones as well, and so they can be the ones that actually refer you to our services to help out.
And so I'm not a parent, and for maybe folks who aren't parents yet, can you kind of talk about, do you know what those milestone meetings are? Because I feel like there's certain appointments that you're going to, whether it be for like booster shots or checkups or things. Age-wise, do you know what those are?
Sure.
Yeah.
So on
go
the
ahead.
speech end of things, a lot of kids will say their first words right around a year.
Okay.
And then kind of the biggest milestones to look for after that, by 2 years old, we're wanting to put 2 words together.
Okay.
So instead of just mom, now maybe we're saying bye mom. And by 3 years, we kind of want to put 3 words together. About by the time their kids are 4 years old, we really should understand pretty much everything they say.
Mm-hmm. And when you talk about mobility, is it just, first steps type thing, or is it dexterity or?
Yeah, for the mobility aspect, it's easy as lifting your head
Okay.
to going to be rolling on your belly or rolling back to your back or pushing up into a hands and knees position so that you can start to learn how to crawl, and then that crawling will develop into kneeling and sitting, and then that will develop into standing and walking. So it kind of covers the whole spectrum. You start at 2 to 3 months by being able to lift that head and start to learn to roll a little bit by the time you're 5 and 6 months, and master that by the time you're 7 or 8 months old, and then so on and so forth down the line. So.
Gotcha. So as we dive into more of our specialized topics today, we've got a lot of acronyms. So you've got AAC and you have UEU. Can we start with AAC? What is it?
AAC stands for Alternative and Augmentative Communication.
Okay.
Really big words, but what that really means is we are using tools and strategies to find a way for individuals who are nonverbal to communicate functionally.
Okay.
So that could look like something like sign language, using sign language, or pointing to a picture to communicate. Or the one that I'll probably speak most about today is speech generating devices. So that looks like communicating with an app on either a tablet or a computer in order to communicate, pushing a button and the computer speaks for the child.
Oh.
Yeah.
So if I'm, again, I'm coming into this topic a little bit blind. Do these devices ever kind of backfire or do the opposite? Like they don't encourage speech, or does it always work?
I won't 100% say it always works, but that is one of the biggest myths that I hear all the time.
Okay.
That I feel like it comes from a place of fear from our parents or caregivers, or honestly, even a lot of physicians, that use of these speech generating devices will hinder verbal output, but it's actually exactly opposite.
Okay.
Research has consistently shown that AAC devices help verbal output. And I see this with my patients all the time, that once they find a way to communicate with these devices, we're hearing a lot more verbal words from these children. So we want to start using them early and help give them kind of a bridge to find a way to use their natural verbal communication.
Okay, well, I'm glad to be able to give you the floor to kind of dispel the myth. And so who are good candidates for this type of therapy?
Yeah, truly and honestly, any ages. Okay. I know we're here mostly talking about pediatrics today. So I primarily think of individuals with developmental disabilities, something like autism spectrum disorder. We hear about that all the time now. Cerebral palsy or Down syndrome. Anyone who's having trouble with verbal output. And it may not be that they're not speaking at all, but they're very difficult to understand. Something like childhood apraxia of speech, that maybe their mom might understand a few things that they say, but if they have another communication partner, they're not really understanding anything. And so that could be a tool that they can now communicate with their friends or in the community or at school. So really anyone who's having trouble verbally communicating could benefit from these devices.
Okay, and might be a smidge off topic, but if a child has maybe experienced some sort of trauma that's caused them to, kind of dial back their speech, could this be helpful as well?
Absolutely. Individuals with a traumatic brain injury. We have a guy in our clinic right now that suffered a traumatic brain injury, but he now uses a device to communicate, and he'll roll down the hall and he tells us jokes on his device sometimes, and we get a good smile from him with that.
Very, very cool to be able to see it in action and see, like, reap the results, I guess. So when it comes to these devices, are these things that insurance typically covers or looks at? I know everyone's is going to be different, but in a generality type sense.
Yeah, so we work hard to get these devices covered through insurance under durable medical equipment.
Okay.
So we will have our patient in the clinic. We usually do a trial to make sure that we're getting the patient the right device, because there's different software and different hardware out there. So we want to find the right combination for each child. We would do a big report and evaluation and send that off to insurance. And typically we've had really good results for insurance covering all, if not a majority of the devices.
And hopefully maybe some sort of a case or covering, because I have dropsies myself, but I mean, if you're a young person, sometimes tablets with screens and...
Yep, most of them have very heavy duty cases and like Gorilla glass screens so they don't get broken, because we've had our fair share of devices thrown across the room.
So let's pivot a little bit. Our next acronym, UEU, I didn't want to mess it up.
That's fine.
Can you please explain what it stands for and what we're working with here?
Yeah, so the UEU it's called the Universal Exercise Unit. A lot of places will refer to it as the spider cage. It is this contraption that looks pretty much like a cage.
You're not selling it too
He
well.
will.
Yeah.
It gets fun.
I know.
Like spiders and cages,
It's a little,
no thank you.
It's a little intimidating at first, but
Okay.
the things that it can do are absolutely
Amazing.
fabulous. So, we recently received it, so I'm still kind of learning it myself and getting new and familiar with it. I put a couple kids in it, and I've seen some pretty amazing results with it.
And so, again, how does it work?
Yeah.
What's happening?
So there's two different strategies when it comes to using the cage. There's a pulley system, and then there's a suspension system. So depending on the child, I will make the assessment on what child needs what, depending on their needs. The pulley system it's simply just pulleys that you would hang from the cage. And what you can do with it is you can isolate certain movements of the body and make kids work against some weighted resistance using the pulleys. Okay. Now, as you can, suspect, it's hard to get a child to move one certain direction. They're kind of usually all over the place because they're kids.
Yeah.
So this is a great strategy if we just want to work on, let's say, bending the knee or flexing up their hip. This is a way we can really isolate that by using these pulleys and really strengthen the muscles that we need to strengthen to improve their movement patterns.
And so how are they affixed? Is it like a wrist and ankle type thing?
Yeah,
or?
yes. So there's a little boot that you attach the pulleys to with a hook that you can put on, or there's a wrist strap that if you're doing upper extremities, you could work on that you could put around their wrist. And they're usually just laying on a table within the cage for the pulley part of it. So they're usually pretty stable when we're working with the pulleys.
Okay. So as far as specific patients that might benefit from this type of therapy, what are we looking at there?
Yeah, so originally the system was created for kids with CP, so cerebral palsy, but you can treat anybody that has any sort of movement dysfunction in the cage. It's pretty appropriate for most children. I've treated autism, CP, any sorry.
That's all right.
Any kid that has a nervous system disorder or musculoskeletal condition will benefit from using the cage.
And then you said that you all recently acquired this technology, and what's pretty great about it, you guys are kind of one of the only in the area to offer this. Like, you wouldn't have to drive hours and hours.
Yeah, the nearest place you could receive services using the spider cage would be like Chicago or St. Louis or Indianapolis. So it's pretty nice to bring this technology to this area and really see what it can do for some of the kids that we service.
Sure. We love to be able to highlight when the technology finally makes it to the rural community. So when it comes to frequency of this type of, and maybe you guys both can speak to this for your respective therapies, is this like a weekly regimen or monthly, or how long do you do it for?
Yeah, so at St. Anthony's, we're getting ready to start what we call intensive therapy. And the Universal Exercise Unit is used commonly in intensive therapy.
Okay.
An intensive therapy program is 5 days a week for, an hour and 45 minutes to 3 hours per session.
Wow.
So it can be pretty intense. But you could also do it in just a weekly program as well. So you could use it either way. It'll just depend on what the child's needing.
Fair enough. And then on your side of things?
Yeah, most of my sessions are like more of the once a week type of thing. It depends obviously on each child. They're individualized to each child. A lot of times that's ongoing therapy that's not going to be a quick fix. So it's a long-term, usually one time a week.
Okay. And so for your guys's, you guys play an awfully important role in office. So I have to ask, what type of homework do you send kids and parents home with to make sure that, between practices or between, over the weekend, that progress isn't lost?
Mm-hmm. Yeah. So a lot of times with devices, we just want the kid to use them.
Okay.
The best thing that parents can do is model on the device themselves, pretend that they're speaking with the device. Some of our kids I will send home like, okay, let's really focus on using the word stop on their device so they can tell their brother to stop bugging them and just model that. If you want to tell your brother to stop, we touch stop and the device speaks and we can really ingrain that. So sometimes I give one word to work on. Sometimes I tell parents, model, use it when you can.
Okay.
Yeah, and I will give handouts to parents, but I'll also invite the parents to take videos of anything that we're doing with their child during therapy so that they can recreate that at home. It's super important that they work on these things at home, especially if they're a weekly kiddo, because really when you think about it, if they're only there once a week, that's 60 minutes out of their whole week, so it's just not a lot of time. So doing those things at home and practicing what we're practicing in clinic is just so important. So I will have parents take videos, or I'll send them handouts, or I'll, if they have any questions, I'll direct them to maybe, a YouTube video that may help them as well. So just trying to, teach them the importance of doing the exercises at home as well.
And I might not have a spider machine, in my backyard or anything. Right. But do you have any simple modifiers? Is it like, can you use the stairs or the couch or an ottoman?
Yeah, a lot of times what we're doing in the cage is really, really focused on a certain movement, but those movements will translate into more functional movements, like going up and down stairs or getting up off the floor. So you don't necessarily need a cage to do those things. You can definitely do those things at home, practicing the bigger, complex movements that we're working towards.
Yeah. And so I gather that your therapy is a bit more specialized, especially with the spider enclosure. I'm so sorry, I can't let that go. But this type of speech therapy, is this typically offered at a lot of therapy offices?
Yeah, so I think AAC and use of devices is offered a lot of places, but we are now doing AAC evaluations here in Effingham. So similar to the spider cage, a lot of our patients were traveling to Springfield or St. Louis to get evaluations for these devices completed. And it's not just a one and done, we go there and figure out what device is best. It often takes many, many visits to figure out exactly what's best for the kid. So now that we're offering that in Effingham, like you said, one more rural thing that we can offer so that people don't have to travel.
And if I'm somebody at home who's just watching this and maybe I have an older child and I'm just now hearing about these types of therapies, is it too late?
No,
it can't be too
never.
late, right?
No.
It's never too late.
Can you talk about maybe some interactions you might have had with older children that have been successful?
Yeah, so I'm trying to think of the most common one.
Yeah.
The one that I was talking about with the TBI earlier, he came to us when he was 7, and he just now started using the device. So before that, he was totally typically developing, spoke verbally, and now he's using this device. And he's caught on. He can navigate that thing faster than I can. Sometimes he likes to turn the volume all the way up and yell at me, and other times he turns it all the way down and says, hey, I'm done talking for the day.
Yeah, we've used the spider cage with some stroke patients that are a little bit older because once they've had that stroke, they've kind of lost the ability to move their arm or leg. So it's been really nice to be able to use some of the older patients in it as well to reteach them how to use that leg and isolate certain muscle groups that we need to.
Sure. So as we're in our last several minutes here, and you both have a decent amount of experience in your respective fields, maybe what changes have you seen since you've started maybe your schooling to now, and how it's helped patients?
One big thing with mine, because it's so technology based, is that there's just been improvements in all the devices over the last several years. The quality of the voice that comes out, the quality of the apps and the software that we're using. Also, when I was first learning about AAC, it seemed like they had to have a certain amount of skills to be able to use an AAC device. But we're not saying that anymore, that there's no prerequisites to use a device, that, you know what, we'll use it as a tool as early as we can. So I feel like the mindset on that has changed some.
Yeah, and from the PT standpoint, I think doctors are now really referring kids a lot sooner. You know, they used to say, oh, they'll eventually do it, but now they're getting them in sooner so that we can really get on top of it and start building those important skills that they really need to be able to be successful.
Oh, for sure. And we are a few years past kind of the deep throes of the pandemic, but did you guys notice any sort of change in how you were able to treat patients during that time, or maybe some ramifications of going through that and maybe not being able to come in office as much?
As a speech therapist, having kids be able to watch my mouth was very important. So treating with a mask was challenging. And so being able to do that again has been very helpful. And I do think we saw a setback in a lot of children's language following masking and social distancing. They're just not learning. They missed a pivotal part of the time where they learned to play with other children and interact. So they missed out on some of those social skills. And I do feel like we're seeing the side effects of that still.
Yeah, and same thing from the PT aspect, you know, during the pandemic, they were socially distanced. They kind of kept inside a little bit more, so they just didn't get as much exercise that, you know, that they would have if it hadn't been, you know, a normal time. So.
Sure, and I feel like being in community as well, you might more readily notice, well, gosh, those 3 kids are, you know, they're walking. I didn't realize that, you know, my child's kind of struggling or whatever. Just kind of having that community aspect could help too. As we're about to wrap up, is there anything else that I didn't ask about that either of you think is important for people to know at home? And maybe if you even have already talked about it, something you really want to drill in?
I would like to also mention that the spider cage and the AAC can be done together sometimes too. That Alex and I have treated together, and while maybe he has a patient in a position in the spider cage, I'm kind of talking with them with their device about what's going on or what they like or what they could do.
Yeah.
At the same time?
Yes, absolutely. Yeah, we often treat patients together, and it works out very well.
And are there any success stories that stick out in your brain that you think is really worth sharing that might maybe encourage a parent that if they're nervous about this to push forward and seek it out?
Yeah, so I recently treated a patient from the Mattoon area. He had CP, and you know, prior to coming and seeing me, he was really struggling with just stairs and walking. But biggest thing was stairs, and really Mom was like getting in and out of the vehicle is hard too. And he's a little bit older, you know, so he's big enough that he could be able to potentially do those things on his own. So I saw him 3 times a week for about 6 weeks or so, and I seen an incredible amount of muscle definition that he built using the cage. And then he began to start doing the stairs independently and getting out of the car independently by himself by the end of those 6 weeks. So it was pretty incredible.
He was so proud.
Yes.
Oh, I bet. No, that's so exciting. 6 weeks?
Yeah.
Wow. Was there another case that you wanted to share as well?
Well, actually, he's the one that I thought of right away because he was just such a big success story.
Yeah.
I do also work with this patient, and he actually uses a device that he communicates with his eyes because he doesn't have great fine motor movement. But he's the biggest success story that comes to mind right away.
And again, I know it might be an insurance type thing, but in our last minute or so, if I'm somebody who is looking to connect with you all, do I have to talk with my primary first, or can I seek you out solo?
To be seen, we do have to have a referral from a physician. If you have just a question about if it'd be appropriate, we might be able to help you, kind of guide you in the right direction, but we do have to have a referral to be seen.
Yeah, we do request that. I know in Illinois there is kind of this direct access, but it's kind of gray. So we just try to cover ourselves and have the referring doctor just send us an order.
Fair enough. Well, Elizabeth Carter, Alex Kastl, thank you so much for coming and being on Being Well today. It has been a pleasure.
Thank you
It's great
so
to
much.
meet you. Thank you. And we thank our viewers for joining us for this episode, and we hope that you will join us next time for another Being Well.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
This is you, and you are why we do what we do. Because the way you feel matters. Sarah Bush Lincoln, trusted, compassionate care.